Hello, this is Jeanette Zijdeveld, physical therapist, with another video for self-treatment, this time of mostly the head and the jaw. Your cranium, your skull, is a big puzzle of bones that are held together by their structure and by fascia. And we're going to work into these parts of the body. And like with the other videos, I use 5 minutes for timing each one, only because I want to give structure to the videos and actually do the 5 minutes so that you can just follow along and don't have to mind the time yourself. But if you get something going and you want to do something longer, then just hit pause. There's the only thing that's great about 5 minutes is that it's long enough to get releasing going. For this one, we're going to use a handkerchief or pillowcase for tongue pull, or something else, some other cloth to hang onto your tongue. At the end, I'm going to use a cranial cradle, or you can also use still point inducer, or if you don't have either one of those, you can put 2 tennis balls in a sock and some gloves, some disposable gloves, 1 or 2 of those for when we work with the nose. So I do think of this one as one that's best to do after you have already done some of the other videos, or you are familiar with doing self-care like this from another way, so that you know how to feel into your body and be very present. I don't think this would be a good video to do as your first one. Okay, so we're going to do a very short warm-up for this one. We're going to do opening and closing of the mouth 5 times to just see how that feels. Is there any clicking or discomfort or anything popping with that? That's 5 times. I definitely have not very smooth movement. Anyway, then side bending at the very top of your neck like this, back and forth. The lower neck doesn't really participate, just the top. Kind of like a wobble head. And then the whole neck, left, right. Feel the difference when the lower neck participates. And then rotation, same thing. Kind of hold your lower neck still and turn at the top of the neck. The joints that are right under the head. And then the whole neck, just a few times, not really pushing for anything in particular, just have the neck warmed up a little bit. And then shoulder rolls. So up, back, and down and forward. And then the other direction. And a few more backwards. And then one at a time. Okay, we're ready for releases. First one, we're going to put a finger on each side in about a spot right there on the face, right here under the bone. find where there's sort of a little indentation. And we're going to do that for 5 minutes. I have my elbows on the table that I'm sitting at. Support it. You can do it free off the table as well and just lean your head forward into your fingers. Right now I'm going to do it this way, but I've certainly done it many times just this way. With the head forward a little bit so that the weight of your head leans into the fingers. That's it. And then we're just going to feel this and imagine and feel for softening there where you have your fingers. So come into your body. Feel your whole body. Check that you are sitting on your sit bones equally left and right, and that your spine is in a lengthened position. Feel your head, and then again feel where your fingers have pressure into soft tissue in your face, up against towards those bones in there, and feel for the effect of that through your body. If there is some unwinding, it can feel like your fingers are changing position a little bit because there's little bits of scooting in there. That's great. And then it might go further and your body might want to change position a bit, like mine's doing a little right now. So then you just go to that position and keep the very same pressure. You want to allow those things without letting go of what you're doing. What do you feel? Does it feel alive in there? Such a nice thing to spend some time taking care of yourself. It's almost halfway December 2023. I had a cancellation, and so now I'm doing this instead of doing a treatment with someone. Sometimes a big breath will just come spontaneously as part of releasing. It can also be something else, a sound or a cough. timer's going off. So on we on we go to the next one, and that is around your nose into the bones like this. This one's called the zygoma, makes up part of your eye socket. And you're going to hold right here just outside the nose with either these two fingers or those, or maybe even those, but I think probably either index and middle finger or middle finger and ring finger. That's what I'm going to go with. Timer is on. I still have my elbows on the table. Can definitely do that free from the table as well. So go in again to feeling in your body. Let your head weight go slowly more and more into the support that your fingers and hands and forearms provide. Feel that support from your elbows up. Have your wrists in a fairly easy neutral position, not some extreme position with the hands and wrists, and especially also not the fingers. You don't want to be pressed where these joints bend back or something like that. If you find yourself doing that, then make your fingers a little bit round to protect your finger joints. You don't want to take care of one thing and put a strain on another. You're just leaning on there with some of your head weight so that you feel like your fingers are slowly sort of sinking in and making an indentation, like sinking into soft clay. That's what John Barnes says. And then what do you feel there? I feel a difference between left and right. You can feel sensations from your body, or also emotional components. Make sure that the primary thing you're doing is sinking in and then opening a little bit. Your fingers moving away from the center, pushing a little bit more into the bones that are there. Feel what you feel. Is there a sense of opening between your hands? My right hand is getting a little bit tired, so I'm adjusting where the elbow is a little bit to make it easier on those fingers. The timer is going off. So now we're going to find the mastoid process, which is right here on each side of the zygoma, well, on each side of the head as part of the temporal bone. This is the zygoma, and this is the temporal bone right here. They have very similar colors on this model, but in any case, it's this process here, quite easy to feel right behind your jaw here. So, timer on. 1 or 2 fingers on each one. I'm still going to have my elbows on the table for this one as well. I'm using my index and middle fingers, and I'm supporting my head with those 2. Again, my wrists are in an easy position. My fingers kind of in a strong position, almost straight but a little bit bent. And just think of supporting the head equally on both sides. It takes focus. And then just let your head have this bit of force. It knows what to do with it. And that is going to be specific to each person, because we all have unique bodies from the unique circumstances that we've all had in our lives and experiences. So let your body do what it knows to do with what you are offering now. Check again that you're sitting nicely symmetrically on your sit bones of your pelvis, that your spine is pretty much lengthened and your head possibly forward a little bit, leaning on your fingers in a reasonable way, not pushing down on them or anything like that. It's not hard to do. If you find it hard to do, then try less hard. Make it easier somehow. I'm starting to feel shifting. So in the first place, I'm making sure that I stay with the same amount of contact and force, that's a big word, but that I started with, so that whatever got it going is still there. My position is just changing a little bit with the unwinding. Takes a lot of focus to feel all that. I'm used to it. If you don't feel a whole lot of anything, that's fine. Just keep feeling, keep allowing. My head's going to go forward a bit now. And I just keep the same pressure. If you have your hands and your elbows free off the table, then there can be more unwinding of the whole spine. But I feel like it's more work because you have to kind of provide an upward push that you don't have to do when your elbows are on the table. You just lean the weight of your head into your fingers. Is your jaw relaxed? And what about your tongue and your eyes? And your shoulders? They don't need to be pulled up in any way. Check your whole body for excessive tension. That's a good way just to even come fully present into your body, checking for tension that doesn't need to be there in the muscles. Oh, timer's going off. So if this was my own session, I would go a little longer because I just really got something going. Now we're going to put our palms on the frontal bone. That's this blue one up here on the front of it. Both palms are going to go on the front part of your forehead, not the sides, the front. So like this, 1, 2, this part of the palm, and the fingers just go on the head. So 5 minutes. And there, kind of like you're going, oh my God. And I'm going to use the table again with my elbows. And we're letting the hands push into the head. So it's a way of compressing. And then afterwards, after this one, we're going to do one that's going to be more of a decompression. So this one, there's no lifting up away from the body. It's just pressing this bone into the head with your position primarily and the weight of your head. You don't need to do any extra effort of pushing, but you do need to work just a little bit to keep pressure, some amount of pressure into your head. And then do however it works for you to scan yourself, scan your body. How are you sitting? Is there any part of you working too hard? Is your face relaxed? Can you get a sense of the pressure being allowed in? There may be tissue memory here, meaning sensations of something that has happened in the past to your head. Taking a deep breath once in a while. If you start to feel sort of a headache, that would be tissue memory. Do you feel the pressure the effect of it spreading out at all into your head or other places? Just showing the position a little bit from the side, like this. If for some reason you find it just too much for yourself, then ease up or stop altogether. All right, the timer's going off, so we're going to switch to now on the outside of your forehead, like this. Same parts of the hands. And this time we're going to lift like imagine that you're doing this to your forehead. Not way back here, then you're in your parietal bones. Still far enough forward. In such a way that you're lifting. Like you're taking the lid of your face off. There is, of course, a sense of pressure of the hands towards each other because of the position, but mostly you are looking for a sense of pressure going up towards the top of your head and beyond. This would be difficult to do without putting your elbows down on the table. And remember, it's 5 minutes, so if you are pushing too hard, working too hard at it, it will be obvious because you will feel like you can't keep it up for 5 minutes. That's another really good thing about the 5 minutes. It keeps you from applying the kind of force that only just shuts your body down into protection. When you want to be light enough that your body is okay with it, and release can happen with time. Okay, I'm starting to feel this from the left side down into my low back. That's interesting. So I'm just going to notice that and be curious about it. What do you feel? Now it feels good. I hope that you might also be experiencing how interesting it is, how much shifting around you can feel in your head. Okay, now still pretty much the frontal bone. Oh, the vomer keeps falling out of the head. Anyway, now we're going to go right here on this part of the frontal bone in the upper part of the eye orbit. So, like this. You're basically, this part of your palm is over your eye, and you're leaning into that part of your palm with that bone on both sides, like that. And your elbows really need to be down for this one. And you just plant your elbows and let it be easy. No pressure, of course, into the eyes at all. It's just about that bone. And we're lifting it up this time through more of the front of it. And there are, of course, other bones in contact with this one. Can you feel any of that? Check your posture. Make sure that your head is not bent way back or anything like that. Your neck needs to be in a neutral position or even bent forward a little bit. And then really mind that you're not putting pressure into the eyes. Your hands are covering your eyes for the most part, but there's no pressure into them. The pressure is into the bone, the upper arch, let's say, of the space that your eyes are in. And after a while, your hands might feel like they're doing a little separating left to right. That's okay. If you don't feel that, that's fine. Don't try to make it happen. Feel what you feel. It might, for instance, be quite different on the left than the right or something like that. And be curious about where else you might start to feel this in your body after a while. You can definitely get sensations that feel like headache to you. Well, in part, you would be then experiencing some part in there that's part of the cause of headache, part of. And if there's unwinding, it will feel like shifting under your hands, and your hands moving a little bit over where you are, and your neck might start to get into it and change your exact position a little bit, so you allow those things, as long as you can keep providing pretty much the same input with your hands into your frontal bone from below. Starting to feel good to me. I'm starting to feel it into my right jaw joint now. Feels good. All right, timer's going off. Next is, okay, 2 fingertips into the notch in the back of the occiput. This is the occiput, back of your head. Your spinal cord comes from your brain through it to go down. And we're going to put 2 fingers right here-ish. So put the timer on. Sit with your elbows on the table and go find that spot right here, a little bit up from the hairline probably. There's sort of a little notch or indentation there. You can do it without putting your elbows down also. 2 fingers or 4 fingers would work also. Be sure not to start pulling on it. Just put your fingers there and first let them sink in. I've got my head bent forward quite a bit. If your neck does not feel good with this, then skip it or do it in a more upright position like this. Yeah, it feels really good too. So this would be with more neck bending, and this would be with less in case that just doesn't work for your neck. If you put your elbows down, then your neck is going to need to be bent forward. Do it the way that works for you. You will still be effective. Just imagine that this tissue back here is going to melt, like you're putting your warm fingers into a piece of cold butter and slowly it melts. This gets tight when we spend a lot of time with our head forward. A lot of people do spend time like that. For some people, this can be very, very tight. This is not a lot of work, okay? It's all about position and focus of your attention and allowing the tissue to soften and lengthen. Your fingers are really just wanting to take up space. One way that you might feel the lengthening is that your chin goes down. What is happening at your jaw and around your eyes? Can they stay relaxed? Now I'm feeling stretch way down, all the way just about to my waist level. Feels nice. Feel what you feel. Keep it light. No forcing at all in this position. That would be risky for getting sore. You just let your head hang and you take up space there in the bit of soft tissue that's there at the very top of your neck and back of the head. No pushing down on the head. All right, slowly bring your head back up. Okay, now we're going to do compression and decompression into the joints. So you're going to have your elbows on the table again, just like this. So around the jaw, the fingers don't do anything, and you just lean on the weight of your head into your hands. The one thing you gotta be careful of is that you don't overextend your neck. So I'm like this, not like that. Okay, this way. And then start to feel how your jaw makes joints here into that temporal bone that we were on earlier. There's the place of the joint right here, just in front of that bone that we were on before. So feel your jaw and let the pressure go into those joints. How does your body feel about this? If you have symptoms in your TMJs, temporomandibular joint, that's your jaw joint, this could be a bit irritating. So feel the irritation, but then if it becomes a bit too much for you, like with anything, then you just stop or make it less. I just felt a big wave of what I can only describe as energy. Again, if there are subtle position changes coming spontaneously from your body, you allow those within reason. And while, within reason, meaning where you can still continue this compression until, well, if you don't want to anymore, then you stop. All right, timer's off. Now we're going to do the opposite. We're going to not have the elbows on the table and the palms go above the jaw and under the zygoma. Yeah, so here, like this. Fingers again, just rest on your head. Your mouth will open with it. Let your let your jaw joints relax and release. Let your muscles soften and lengthen. So with muscles, I mean the ones that your palms are in. Feel what you feel, especially left-right difference. Alright, that was 5 minutes on that one. There is another video with TMJ techniques that's short. If you want more of that, then do that one. Okay, now we're going to do the roof of the mouth and these little bones right here. So our thumb is going to go in our mouth right there. There are 2 bones here that your teeth go into. It's called maxilla, one on each side. And then palatine bones. It can feel different in there for each person. There can be a ridge or not. So let's go see what we feel. So your thumb goes in your mouth and your finger, one of them, goes just right there at that intersection of those bones with the frontal bone. Can be 2 fingers too if you like. If you find a spot here that's tender, then go there. Emphasize that. And then imagine that you have a connection here between your thumb and your finger. And there are quite a few little structures there that you can influence that way. Definitely not with the elbow on the table for this one. You don't want to put weight into it. Do your best to kind of figure out how much pressure does my body want there, and then respond to that. Oh. Okay, timer went off. Now we're going to go into the nose some more. That's what the glove is for. So you can do two ways. I think I'll use my left hand. You can use whichever finger you want, really, and go into the center of your nose. If your finger pad is in this direction, you're going to go with the pad of the finger. Or you can go on the other side, and now the pad of my finger is on this side, and I would go more that way. You can also just allow your finger to go up your nose. So it can be something to kind of figure out for yourself how you want to do this. If you take your pinky, it's going to go in farther, and you can work better on further up your nose. But you're going to have to be very patient. I'll do that. So there are multiple ways of doing this one thing. Sound funny now. I'm just going to very slowly wait for my pinky finger to go up my nose farther, and my finger pad is currently towards the center of my nose, so that's where I'm going to allow contact to happen some, very little. And we will do the other side too, and we'll do the other side in a different way, just so you have a couple of ways of doing this part of your body. You can also use lubricant, like just a water-based. Especially if it's just really dry in your nose. So think of it as just taking up space, and your body's sort of going like, oh, I could stretch a little to let that in, but no pushing for it. And we're going to do this one actually less than the full 5 minutes. I'm going to do 2.5 minutes, and then we'll do the other side. This, well, for me, this is not my favorite way. Maybe that means I need to do it more. Okay, so that's at 2.5. Okay, now another way, so I could also go with the finger pad that way. Another way I like to do it is to put my thumb in my nose. I'm going to do the other nostril since I just worked on this side. But you can certainly do both ways on one if it needs work. So we're going to do 2.5 minutes now on the other side. So I like to put my thumb pad in there, and then 1 or 2 fingers somewhere on the outside of my nose. Timer's back on. Yeah. And then just working using the nostril as a handle into the nose structures. For me, this always feels like it goes really deep. So I'm holding this nostril and I'm kind of using the weight of my hand and forearm to pull. Pull is a big word. And monitor your body on the inside for what is okay. If it feels like pain, definitely not. If there is pain, then you adjust the amount of pull so that you feel it, but it's not excessive, and in such a way that you can let go of it. That's a learned thing. That's why I do these videos, to help you with that. And being treated is how you learn that also. And of course, these videos of self-treatment, self-care, are meant to be in conjunction with getting treatment from a John Barnes trained myofascial release therapist. Oh, I really feel it now. I love doing this one because it feels really good. Now I feel it in my spine and in my face, all kinds of places. So that tells me this really works for me. All right, let's do 2.5 minutes. So do the way you like, and if you need to, especially if you do the video a second time or more, change it up, do how you like to do it. Okay, now we're going to the tongue pull. So take your cloth. Gotta get my timer started. Grab your tongue. And then you just hold your tongue. Your tongue is a very active and quite strong muscle, and it's big. And so you have to approach it with respect and go really slow, because otherwise it's just going to go against you. No elbow on the table for this one. You can even use both hands. Just hold it and wait. Wait to feel the whole tongue. Feel how far back it goes. And how it connects into your neck, the back of your head, however it feels to you. And the head again is down a little bit. Please don't do it like this with extension of your neck. Sit up, bend your head forward a little bit. Another thing that can be different for people is, for me, my tongue gives more in that direction. For you, it might be more in the other direction. So if you feel that, go with where your tongue goes. And say a little thank you for all the work it does for you, talking, swallowing food and drink, and all these things it does all day. Be grateful, be curious. timer. Okay, now we're going to work the sphenoid. That's this big yellow bone in here, in the center of your face and head there. It's in the back of the eyes there, same bone. And on the outside of the cranium, it looks small. And that's where we're going to approach it through. So once you have the position, imagine connecting through that whole bone. So you can do this with your elbows down or not. So go to the outside of your eye here and back a little with either index or middle finger or both until you hit sort of a softer spot. Yeah. And there's very little pressure here, just a bit towards each other. Imagine you have laser beams coming out of your fingers, going into your head. Be aware of how you're sitting. Check that again. Are you good and upright? And then just feel for that beautiful sphenoid bone in there. When you see it by itself, it looks a little bit like a pelvis. And when I did my book, my fascia release for women's health self-care, I was looking to buy images of the pelvis, and there was a sphenoid among them, where someone had mistaken the sphenoid for the pelvis and had categorized it with images of the pelvis. Alrighty, try to feel for unwinding. It's interesting how I often get the most unwinding. My low back is also changing position a lot more than you can see. Now my whole pelvis and spine and head are into it. Again, I'm used to this, so you will get used to it if you're not already by trying and feeling for and repeating. And here's where I can't go. Okay. And so there doesn't have to be movement. It's just that when it happens naturally, you want to allow it. Okay. So I'm up against some big barrier here. It feels very stuck. I can feel a wanting, a desire of my body to go this way. Oh, there we go. We just got through something. Oh, and it's blocked somewhere at the level of the junction from my thoracic spine to my lumbar spine. Okay. So don't compare yourself to the things I'm saying. I'm just having my experience. And isn't it amazing that you can have an effect on your body from connecting and feeling for this bone? It's really quite understandable in a way because it is in contact with all the other cranial bones. It's just so amazing because you just sort of have it between your fingertips, and you're certainly not making it move. And if you have no movement at all, don't worry about it. That is not the goal. You can have great benefit even with it just not moving at all. Mm. So for me, my whole spine got into it. That doesn't have to happen, of course. Okay, now we're going to try just for a couple of minutes holding up the head through the occiput. Before we were here in the tissue with our fingertips. Now we're going to be here, 2 fingertips each side, like this. Going to go on the back of your head, elbows down. Support the head through each side of the occiput and let go in that same fashion. Okay, my head's bending forward, that makes sense. The muscles in the back relax. You might feel a lot of tension there in the back muscles of your neck. You can let go of your elbow support if you'd like, but it is easier to do with your elbows on the table. Like you are taking the weight out of the head partially, and then you just see what happens. Is it the muscles in the back of the neck that are going to stretch, or something else? What's going to happen for you? It could be something more in your head. For me, it starts to be all about the back of my neck. Says, oh, I want to stretch. So I just keep, the same contact into the occiput, and the pressure comes from leaning into the table like before. All right, so if you want to do that longer, do it longer. Now we're going on the floor for the last 2 things. So first is ear pull. You can also do this sitting or standing. I find this the easiest. So put your elbows, just let them rest on the floor. Index fingers go into the ear like that, and then your thumb somewhere on the outside of your ear, not this part, the more inner part. And then first just feel your ear. And then slowly start to exert a tiny pull away from your head. And imagine that you are pulling through your head in some way or another. And then feel for what happens and go along with that. So what I mean is, maybe it feels like, well, I'm just kind of naturally starting to pull up towards the top of my head a bit, or more down towards my feet, or something like that. Or not at all, or just playing away from the head. And so just follow what's already happening. If you need to regrip because you slid, then regrip. You don't want to end up on the very outer portion of the ear. And then check your whole body again. Are you relaxed on the floor? You can have your legs out straight, or they can be bent with the feet a bit apart and the knees leaning against each other or something like that. Let go and deeply rest your body on the floor. Get your tongue to relax a little bit more. Get it to remember what we just offered it earlier. Remember that we worked around the nose and into the muscles that, one set of muscles that closes your mouth, mostly the masseter, and into the jaw joints that are really just right in front of your ear. Can you feel them? Your eyes relaxed and your forehead. You might even find that your direction of pull has changed so that it is not exactly the same on the one ear as it is on the other, and that's fine. I do love my ear pull. It should be pretty easy to do. I mean, the work is in the focusing on the feeling. All right, timer's going off. Last thing is just sort of finishing up with the occiput. No, not the occiput. The craniocradle under the head. I'm going to put a timer for 3 minutes just so we're not so very long. It goes under your head like this with the fat portion under your occiput. And then you're just going to fully, deeply relax. If you don't have the craniocradle, you can use the still point inducer right smack under your head. If you don't have that either, then 2 tennis balls in a sock just under your head so that it can balance without your head tilting back, especially you don't want that. It's okay if your chin tilts down. So this is something that I do quite often at the end of the day where I'm like tired and I don't want to do any effort, just want some relief. And then I just lengthen a little bit in my body, and then I just start to relax and rest very deeply. After a while, you probably will feel something in your body somewhere else. Just be interested and only just feel it and observe it. Don't need to do anything with it, or especially not against it. Excuse me. All right, that was just 3 minutes. If you want to go longer, of course you do. And I would say thank you for taking care of yourself, and see you at another video.